Hi, Hazel from Training here. The following videos are NHS guidance to show you how to safely put on and take off your PPE. As well as watching these videos, we should be keeping ourselves up to date via the Care by Us portal and reading the most recent COVID-19 policy, which includes Care by Us donning and doffing procedures and the COVID-19 sign-off sheet, which includes the most important information at a glance. Things that we should be doing every day are showering and washing our hair, including our hair ties. We shouldn't be wearing anything under our tunic, especially long sleeves, because it gives COVID an extra thing to stick to. We must wash our tunic and our other clothes every day, plus iron and tumble dry at a high heat. Washing at 60 degrees alone doesn't kill COVID. Please ask for more tunics if you need them to ensure that you have enough. We also shouldn't be putting on glasses or sunglasses or visors or face masks on our head. COVID may be on our hair, making it more likely to get into our eyes. And many people have contracted COVID because we have cells in our eyes that are extremely attracted to COVID. Okay, so now you're going to watch the donning video.
Part 1. Donning or putting on the personal protective equipment. For doffing procedures or taking off PPE, refer to the later part of this video. Putting on or donning PPE. Safe work practices are to protect yourself and limit the spread of infection. Keep your hands away from your face and the PPE being worn. Change your gloves when torn or heavily contaminated. Limit surfaces touched in the patient environment. Regularly perform hand hygiene. Always clean your hands after removing your gloves. Pre-donning instructions. Ensure the healthcare worker is hydrated. Tie your hair back. Remove jewellery, so no stoned rings, watch, bracelets, etc. Check the personal protective equipment is in the correct size and available. Clean your hands with alcohol hand gel or rub. If not available, use soap and water. Here are the recommended PPE components. Apron. Alcohol hand rub. Gloves. Eye protection, if a risk assessment indicates that these are required to prevent splashing to the eyes. Fluid-resistant surgical face mask. Personal protective equipment should always be worn before entering the room where the patient is. Put the PPE on in the following order. Step 1. Put on your disposable apron. Make sure the ties are securely tied at the back. Step 2. Put on your surgical face mask. Carefully make sure it is secure around the ears. This type of surgical face mask is secured around the ears with elastic. Ensure that the mask is flat against your cheeks. With both hands, mould the nose piece from the bridge of the nose, firmly pressing down both sides of the nose with your fingers until you have a good fit. Once the surgical face mask is secure around the ears, make sure it fits well around the nose and then extend the mask down to fully cover the chin. For surgical face masks with ties, position the straps on the crown of your head and tie the bow above the ears. Tie the lower straps at the nape of the neck securely. This shows the health or social care worker fully donned wearing a surgical mask with ties. The top of the face mask should fit securely around the nose and the bottom of the face mask should extend carefully over the chin. Note: surgical face masks can be single-session use and used while attending to a number of patients. However, gloves and aprons must still be changed between patients. Surgical face masks should always be well fitted, covering both nose and mouth. The surgical face mask must not be allowed to dangle around your neck after or between each use. Your surgical face mask must not be touched once it is put on, and it must be immediately changed when it becomes moist or damaged. Each surgical face mask must be worn once and then discarded as infectious clinical waste. Step 3. Put on your eye protection. This must be worn if risk assessment shows a chance of splashing into the eyes. Note: regular corrective spectacles are not considered adequate eye protection. Step 4. Put on disposable non-sterile gloves. There is no requirement for double gloving. You have now completed the donning of personal protective equipment. You are now ready to enter the patient area.
So you've just watched the donning video. As support home workers, we need to add a few more things when putting on your PPE. If you're able to, you should be donning your PPE just before you enter your service user's home. You should be putting on your shoe covers before anything else, after you've risk assessed that it is safe for you to wear. And please never ever wear your shoe covers on the stairs. You must wear long sleeve covers if you're unable to access good hand washing facilities, and they must be put on before your gloves. When washing your hands, you must also wash right up to your elbows, and if applying sanitizer, instead of washing, you must rub it in all the way up to your elbows. If donning before entering, you must apply hand sanitizer to your gloves just after you've entered, because you've just touched the front door, etc. Okay, now it's time to watch the doffing video.
Doffing or taking off the personal protective equipment. For the donning procedure or putting on PPE, refer to the earlier part of this video. Taking off or doffing personal protective equipment. PPE should be removed in an order that minimises the potential self-contamination. Before leaving the room or cohort area where patients are being cared for, remove and dispose of your gloves and apron. Once outside the room, remove your face mask. Dispose of them all as infectious clinical waste. Step 1. Remove your disposable non-sterile gloves. Grasp the outside of the glove above the cuff and peel off. Hold the removed glove in the remaining gloved hand. Slide the fingers of the ungloved hand under the remaining glove at the wrist, and then peel the remaining glove over the first glove and discard. Clean your hands with alcohol hand gel or rub. If not available, use soap and water. Step 2. Remove your disposable apron. Do not touch the outside as it will be contaminated. Unfasten or break the apron ties at the neck and let the apron fold down on itself. Break the ties at the waist and fold the apron in on itself. Do not touch the outside, this will be contaminated, and then discard in the clinical waste bin. Step 3. Remove your eye protection if worn due to the risk of splashing. Hold both arms of the eye protection and lift and pull away from the face. Discard after use. Clean your hands with alcohol hand gel or rub. If not available, use soap and water. Step 4. Remove your surgical face mask. This should be done outside the isolation room or cohort area. Using both hands, grasp the elastic ties secured around your ears. Stretch them and carefully pull away from your face. Drop into the clinical waste. If glasses are worn, carefully remove them and clean them with an alcohol lens wipe before washing your hands. Do not replace them again until you have completed hand hygiene. You can now wash your hands again with soap and water. You have now completed doffing of the PPE. For further information, please refer to the Infection Prevention and Control Guidance in the COVID-19 Guidance Collection on gov.uk.
As support at home carers, you would normally be taking off your PPE outside, so have your rubbish bag ready. If you've worn shoe covers, they must be removed first, and if you've worn sleeve covers, they must be removed before your gloves. Then you apply sanitising gel all the way up to your elbows, but please make sure you wash your hands and arms with soap and water after every 5 applications of sanitising gel, otherwise it gets sticky, which COVID loves. Then close your eyes and pull the visor away from your face. Don't dispose of your visor or goggles unless they have a foam band. Those ones are single use only. If that's the only one you've got, please ask for another visor. When removing face masks, please close your eyes, lean slightly forward and pull the mask away from your face. Remember, COVID loves your eyes. And please dispose of your face masks after every single visit. If you are able to use good hand washing facilities, please use your paper towels provided by Care by Us, not the service user's hand towels, and remove everything except your mask and your visor. Wait and do this outside your property. This will protect your eyes. At the end of your doffing, please remember to clean your visor and your own glasses if you've worn them. And if you haven't worn your shoe covers, please clean your shoes with the Milton spray which has been provided and the paper towels. But please ensure that you wear shoes that are able to be cleaned, otherwise you might ruin your shoes, and Care Bears can't be responsible for that. Please make sure you dispose of the rubbish in a sealed bag in the outside bin, and once you've done that, please sanitise your hands. Okay, that's it for now. You all take care of yourself and keep safe. Bye bye now.